Hello, I'm Rakshitha. I'm a lead journalist with Healthcare Business International. Today we have with us Mark Middleton, CEO, ICON Group. Welcome, Mark.
Thanks. Great to be here with you in Paris.
Thank you very much for joining us today. So let's get straight to the questions. Where do you see the biggest opportunities for innovation in oncology today?
Well, I think it's a great question and it's a multifaceted answer. There is a tremendous opportunity in automation and or AI, whatever you want to call it. The stark reality is in oncology globally, we're facing some real workforce challenges. When we talk about oncology-specific professions, radiation oncologists, medical oncologists, medical physicists, radiation therapists, pharmacists, nurses, the list goes on and on and on. Great challenge will be we need to deliver more oncology services in more places. To do that, we need to enhance our people. We can't train the number of people that are required. That's the reality. So we have to embrace innovation and we have to embrace technology. That's where I see the greatest opportunity. How can you make your people even more effective so they can deliver more care to more people?
That's really good that you made the point about AI. So, because my next question is, how is ICON Group as a company leveraging data, AI, or digital tools in general, to improve your decision-making, clinical decision-making?
Well, we are very fortunate in that we're an integrated oncology business. So we span from chemotherapy compounding through pharmacy services, through medical oncology, through to radiotherapy, which means we have enormous amounts of data. And inside that data is held enormous amounts of knowledge. So if you have tools whereby you can automate certain processes, and the great example I will give you, for example, is radiotherapy planning. These were exercises that were largely manual in the past. We've now automated those, which makes our physicians more effective in being able to see more people, but it also aids them with their clinical decision making, because a lot of the work that is absolutely essential and vital, but is also routine, is now done for them. That doesn't mean the responsibility doesn't still sit with them to check all of that work. It does, but it's reducing hours and hours of work. The other example I would give you too is using an ambient dictation device, for example, that is actually taking notes while a clinician talks to a patient and a family, a scribe. It's an ambient scribe. And what that means is that one of the great challenges in cancer care is patients are taking in enormous amounts of information, so are their families. It's very hard to take that in when you're receiving a cancer diagnosis. So this is not only an efficiency tool, it's an education tool. It's a reassurance tool. And we've had one clinician, for example, who's been trialling this for us. Letter writing's been reduced by 20 hours a week. These tools are incredibly effective. You've got to harness them, and you've got to harness them in the right way. But we're really just scraping the tip of the iceberg of what's possible.
That's very interesting. Maybe looking at it from an investor's perspective, Mark, what makes integrated cancer care platforms like ICON Group attractive to private equity or other investors?
Well, I think we're very fortunate that ICON's quite unique in our integrated model. But what it means is you actually have the whole value chain of oncology. You're mixing and you're prescribing, and you are mixing an individualised and customised course of chemotherapy for a patient. We then have this incredible logistics chain where we're taking that chemotherapy to wherever a patient is having treatment, and it doesn't have to be an ICON treatment centre. It's a public hospital, it's a private hospital, it's someone else's cancer centre. All of those things. Our pharmacy services allow us to obviously then prescribe that treatment and deliver it. And then you're delivering in our own chemotherapy day hospitals. And of course, many, many patients have a combined course of chemotherapy and radiotherapy. It's very effective because you're able to present to a partner, here's what ICON can do. What do you want from our services? We don't need to provide everything to hospital partners, but we can. And I think that makes us a preferred partner for many hospital groups, lots of governments, and also that in itself makes us very attractive to private equity. I could go on and on and on. Diversified revenue stream, defensible business, infrastructure, like all of those things makes us very attractive.
That's great. Many thanks for being here with us today.